I just wanted to make a quick video for anybody that might be having a TEE test done, a transesophageal, whatever, echo. I am having one done tomorrow morning. I have to check in at 11 and then the procedure will be at 1. I had done research, I had tried to search for YouTube videos, and I just couldn't find anything that was like a recently video that talked about it. So I just wanted to kind of do one just to kind of give an updated, like scenario for everybody. I am 27 years old and I am having a TEE test done tomorrow morning at St. Luke's in Lee Summit, Missouri. The reason that I'm having a TEE test done is I had a miscarriage in May and had a D&C the beginning of June, and 2 days later I had a pulmonary embolism, and I also had blood clots in my kidneys. And so I kind of kept on my doctors about the blood clots in my kidneys because it didn't really make sense and there wasn't a lot of information on it. And doctors really just weren't telling me anything. They just said, like it can happen. And I just wouldn't settle. So I actually seen a cardiologist for heart rates that kind of jump up and down here and there. And sometimes I just feel cruddy and out of breath. So I went and seen a cardiologist and I wore a Zeo patch for 2 weeks and everything with it pretty much came back normal. So he mentioned maybe a PFO. So he ordered a echo on my heart. That was about a month ago, or maybe like 3 weeks ago I did that. And it actually ended up coming back that I had a PFO. So tomorrow morning, that's what that'll be for. Basically with a TEE test, they sedate you a little. It's like a twilight sedation. They put you under, they spray the back of your throat, and then pretty much you like doze out of it. And then they pass a tube, like a camera down your throat and into your chest to take pictures of your heart and to measure that hole. So that hole, they believe maybe is what caused the blood clots in my kidneys. Because normally, especially when you're pregnant, you develop blood clots, you're more prone to developing blood clots. So what they're wondering is maybe I developed a blood clot from the pregnancy and the D&C, and it was, it developed and it passed through my heart, and then instead of going up and causing a stroke, because that's a lot of what happens, it's called a TIA stroke. Those are caused a lot of the times from PFOs. And so instead of mine going up and causing a stroke, it actually went down and into my kidneys, which then they believe that when they did the D&C and they were in there messing around, that it could have caused it to actually then the clots go up and into a pulmonary embolism. They don't know for sure. Obviously, that's not something that we'll really know what happened. It's just, kind of trying to figure out where they came from and why they, developed. Because I am young and I've had a normal, healthy pregnancy 5 years ago. My son was just fine. So it's kind of just trying to figure out what caused it and to see if, if this is going to be a future issue for any future pregnancies. So tomorrow they'll measure that hole. And they'll determine if it needs closed or not. More than likely, probably mine's gonna need closed. Depending on the size, but because mine has already caused me problems, they don't want that to happen again. So it'll probably have to be closed. I haven't really decided, obviously, yet what closure I'll do, but I have looked into the Noble Stitch, which would require me to travel to have it done because there is only so many doctors in, around here that can do that. So that'll be something that I'll have to look into, but I'm just hoping tomorrow's an easy go day. But I will definitely keep everybody updated. As of right now, I have to stop eating. So it's like 12:15, I think here, midnight. So I cannot eat anymore tonight. They cut you off at midnight. I cannot drink anything else, which is killing me because I'm so thirsty right now. Of course, that's what happens. But no more drinks tonight. Tomorrow I am able to take any medications I need. I don't normally take medications in the morning, so I probably will be just fine. But if you need to take any medications, if you're a diabetic, anything like that, they'll let you know what you can and can't take. So no medications for me in the morning. It will be hard to not drink because my procedure starts at 11 to get me prepped and everything, and then starts at 1 o'clock. So that's a long time to go without anything to drink, but I'll be just fine. I'll get through it. So, but I'll definitely keep everybody updated and do a full video and post it. So that way people have that to look back on, because like I said, I've Googled to find out information of the procedure and how it went for people. In the most recent years, I've seen some from, a couple years ago, but it would really be cool to have something most recent. So I'll definitely post that. And of course, try to answer any questions I can as best as I can. I'm a worrier, and I also, I'm always nervous about anything that involves me having to be put to sleep or anything that sounds uncomfortable. Especially with me and gag reflex, I can't even take a big pill. Like, it has to be, smaller than Tylenol, or there's no way I can take it. So my B12s are round and they're not coated, and they're kind of big, and I choke on those. So I'm really anxious about tomorrow, but I think it'll go good. I'm praying it'll go good. But yeah, I will definitely update everybody and let you know how it goes. I will give you an update in the morning as well. Going in, just kind of about everything, but I'll definitely update everybody. Night. I'm here. So they've got me all hooked up, have my IV in, finger monitor, my blood pressure. I had to do a pee test, and I think they took some blood too, but just now waiting to go back. I'm out. My throat is so sore, and it's mainly this side. When I swallow, it hurts so bad. But we're at Walgreens right now, getting some cough drops or like soothers or whatever, and some spray. So I'm hoping that'll help. I'm gonna take some Tylenol when I get home. I don't have any water with me, but I'm still a little loopy from the anesthesia. They did completely put me out. I was not alert at all, but I'm craving some food because I have not ate since last night at midnight, so I'm starving. It's 4 o'clock. I went in at 11. They came back and got me at, I want to say it was like 1:30, 1:40 maybe. My procedure started, it was supposed to start at 1, and then they didn't come get me till 1:30ish, and then they took me back and kind of asked me a couple questions and had a little small talk with me, and then put the bite thing in, and then I was out. So woke up in the recovery room, and my blood pressure was a little low because it normally is low, but it came up. My heart rate was a little low, but not anything crazy. It was like 57, I think, and I asked about that because normally it's not like that, and she said that it can be like that after anesthesia. So everything's good. Hey guys, so it's the night of my TEE. So I had it today at it was like 1:30ish when they finally brought me back and did it. We got there at 11. They came and got me at about 11:30, took me back to the pre-op room, got me all ready, had me take a urine test just to make sure I wasn't pregnant, and then had me put a gown on just from my top up or whatever. And then they took some blood work. That was about it for the pre-op. I mean, they did put an IV in, and then they took blood from there and got me ready. And then the anesthesiologist came in and just talked to me a little bit about everything that was going to go on. They did completely knock me out for mine. I guess at my hospital, that's what they do. They don't do like a twilight sedation. It was with propofol. So they just completely knocked me out. But he came in, asked me if I had any questions. I didn't have any questions. So then he went out, and then another doctor came in, another anesthesiologist came in, and just to kind of get me ready. And he kind of explained things too, and was super, super sweet. He knew that I was nervous, so he kind of tried to help me, ease that. But then they took me back. I waited for a little bit, and I just watched some TV and just waited. And then they came and got me, and they took me back to the operating room. And the doctor came in that was performing it, and she was really sweet. She came in, asked me if I had any questions, kind of explained the procedure to me, and then that was about it. So then they put the bite thing in my mouth. They obviously checked my teeth to make sure I didn't have any like loose teeth or anything like that. No like tongue rings, nothing of that sort. Put the bite mouthpiece in, which felt really weird. That was like the weirdest, most like uncomfortable part of it, because I was like, I don't know, I felt claustrophobic with this thing like around me, but it was fine because then I was knocked out. But they put this thing in, and they turned me on my side, put the like pillow back behind me, covered me up, and just kind of like talked to me and was asking me questions. Like they were asking how old my son was, and just like how he was as a kiddo, and just like questions. And then within like seconds, I was asleep. So the doctor, they did put oxygen in, and that's how he was just like breathe in and breathe out. And within like 2 to 3 breaths, I was like, I just fell asleep. I just remember thinking to myself, well, here I go. And I just fell asleep. And then I woke up in the recovery room, and I just was really out of it and tired, but I was really chatty. Like I do that when I wake up. And so I was counting to myself on how many questions I had for the nurses. So I was like, oh, I've got this question. I had like 10 questions, and I like counted on my fingers. That's how goofy I was. And then when the nurse came over, I couldn't remember any of my questions. So, but they were really sweet, and they made sure I could go to the bathroom. I went, made sure I went pee before. And then that was really it. They just kind of let it wear off and checked my vitals. My blood pressure was a little low at first, but it started coming up, and then my heart rate was a little low. It was at like 55, and it did finally come up a little bit. So then they sent me on my way and took me out to the car, and I was headed home. Now I will talk about kind of how the pain felt. So as soon as I woke up, I felt my throat was hurting. At that time, it didn't hurt too bad. It was just kind of like an uncomfortable feeling. Back when I had a DNC in May, the end of May, I had woke up and my throat was a little scratchy, but that was it. And then it went away really quick. So I kind of just figured that's how I would feel this go around. That's not how I feel. So all day today, I have struggled with this pain right here. It's like right here, and like right here, and it was hurting down in my like sternum every time I would swallow. That's kind of let up, and now it's just kind of right here, but it feels like a rock is like caught in my throat, and I like need to swallow it, and it's just like very painful. Yeah, very painful. But I'm hoping that will let up tomorrow. I can't unfortunately take any ibuprofen, and I feel like that would help a lot because I think it's just like inflamed and bruised. But I can't take ibuprofen because I'm on a blood thinner, so I have to stick to Tylenol. I took 1,000 milligram and it didn't really seem to help too much, but I'm gonna go ahead and take another dose of that tonight and hope that helps. But I've just been sticking to hot like teas and hot soups, I tried to eat some chips and dip earlier because I was like craving it, and I just wanted something to like chew on. It was terrible. It hurt so bad. And then I also tried an applesauce, and that hurt so bad. And I think it was like the coldness, because I tried to drink ice water thinking that would help, and I was eating ice chips at the hospital, and it was making it worse. So the hot tea and the honey has been more helpful. I'm hoping tomorrow I feel a lot better, because I do have to work tomorrow and be on the phones all day and talk to clients, and so I'm hoping I feel better. Oh yeah, that hurts. But other than that, I did get some throat spray, but it doesn't seem to help because it's not in my throat necessarily. It's more like down here. So it didn't really help. It kind of numbed my tongue and like the back of my throat, but that was about it. But I'm just praying tomorrow is a better day. I'm praying that tomorrow the pain lets up, but the TE looked good. I got my results already. I do have a PFO, and I've got some plaque, I guess, that I need to talk to my doctor about and just kind of see, what that means for cholesterol, because I am a little bitty girl that doesn't eat much meat. I don't eat real fatty foods or cholesterol high, foods, so I'm not really sure what that's about, but I'm going to talk to my doctor and get that figured out. Probably if I need closure, I'm going to more than likely get the Noble stitch. Hopefully, I know that there's only so many people around the area that do that, so I'm going to have to definitely figure that mess out. Yeah, it is pretty painful, so if you have this, I'm assuming it's normal. They told me of like that my throat would hurt and be scratchy, but I don't know, I guess maybe I don't know if this is considered your throat or not, or more like your esophagus, but it does hurt. It's more just feels like a knot in there that you just want to like swallow out, and it's just like not going anywhere. So hopefully tomorrow, but basically it went really good today. It was a lot, I was terrified that it was going to be like this. I was going to remember it, or I was going to like hear them, or I was going to like gag. And I don't remember any of it. I just remember falling asleep. So I don't know if all hospitals do that, but mine did. So mine didn't completely knock me out. So it went easy, but definitely some pain. I'm just drinking my hot tea and hoping for the best tomorrow. Okay, so it is January of 2023. I know that my TEE was done back in September of 2021, so I know it's been a little bit. I did a really terrible job documenting after that first day, and a lot had happened after that first day that I wish I would have documented, but I just didn't. So I thought I'd go back and just kind of talk about what had happened, what came from the TEE, and then like moving forward what's going on, because I feel like it's super important for anybody that's having one done, that maybe wants to know, like the ins and outs of like other people. So like I said, it is January of 2023, but I had my TEE done in September of 2022. I had it done. I came out. I talked about that. I came out. It was kind of sore that night. It was really sore. The next day and going forward for about a week, it was about maybe 3 days, I would say at the max is how bad it was. But for those first like 2 to 3 days, it was rough. It was rough. I felt like I had a rock stuck in my throat. I could not eat. I could not drink. It was very painful. I don't know if they used like maybe the wrong size on me, because I've read that they can use like a smaller size on people, and then they have a bigger one. So I don't know if they used like the bigger one, or I don't know what went wrong, or I don't think anything went wrong. I think that's just how it is. But unfortunately with mine, it did hurt. So for about 3 days after, it hurt. It felt like a rock was just stuck in my throat. So I called my doctor and the one that did the procedure, and I was like, hey, like, I don't know if this is normal, but definitely having some soreness in my throat that's, very uncomfortable. Is this normal? What should I do? I'm not eating, I'm not drinking. I actually didn't even work for about 3 days after because I couldn't even talk. It would hurt so bad to talk, it hurt. And so the doctor was like, you know what, I think I want you to come on back in to the ER and just have like a x-ray or like a image done of my throat just to make sure that like they didn't tear anything or they didn't do anything. So I was like, okay. So of course I went in, and of course the ER doctors literally looked at me silly and were like, it's gonna hurt for a couple days. And I'm like, I know, but my doctor said to just come in, make sure everything was good. So anyways, they did the x-ray, everything came out good. They just told me, you're gonna be sore, it's gonna hurt. So I went home, and about 2 days later I felt a lot better. So it took about probably 3 to 4 days. It hurt. It was painful. Like I said, I don't know if it was just because they used the wrong size, like tube or scope to go down, or I don't know, but it hurt. I don't know if I gave them a fight, maybe going down, and that's why. I don't know. It did let up, like I said, about day 4, I think it let up. But they said that was normal. So if you have one done and it hurts pretty bad and you're like, what in the heck? And you're like, it feels like something, it just felt like a rock. Like I had swallowed a rock and it would not pass. It was just stuck on this one side, and it was like my right side. It was miserable. So they said it was normal. Like I said, about 4 days later, I felt fine. Everything was back to normal. I haven't had any issues. But I did get my results, and sure enough, I have a PFO, a hole in my heart. So I am flying out to Florida. I'm just waiting on insurance to get approved. The doctor, I've already met with the doctor. I did a telehealth with him meeting, and he has already approved to do the surgery. Now I just have to wait for insurance to probably deny it the first time, and then the nurses will kind of work with them to get it approved, because there is a procedure here in Kansas City, Missouri that they can do to close that hole, but I don't want that procedure done. I would rather have the stitch done. It's called the Noble stitch. I would rather have that procedure done, so I am trying to get my insurance to cover me flying out to Florida, having that procedure done by Dr. Thompson, and have it that way. The reason why I've chose that way is just because the one that most doctors around can do is called, it's a device they put in, and it's a PFO closure. They put a device in. It's kind of like an umbrella. It goes in through the hole, and then it opens up like an umbrella, so it closes that hole in the heart. A lot of people have had it done. I know one person, I think it's Justin Bieber's wife, I think she had it done. So it's very common. PFOs are very common as well. It's just not always are they closed. Most doctors don't close them. But if they cause a problem, like mine has caused a blood clot to travel, to a PE. So they want to close mine. But I really don't want it's a foreign object. So I don't really want a foreign object in my body if I don't have to have one. So I've found this Noble stitch where they go in down through your groin the same way that they would do the other one. They go up through your heart, up through your main artery to your heart. And then they stitch the hole closed, just like they're stitching a hole, in a clothing item. They stitch the hole closed, and then come back down through your groin. Same thing that the other one does, but it stitches it instead. So I have chose that one just because if the other one, if they get in there, they put it in, and 5-10 years from now it starts causing me problems, and it's like rejecting because it is a foreign object, to remove that device that is a common device, not the Noble Stitch but the other one, they would have to go in for open heart surgery. So I'm gonna try this other option, see maybe if it works better, and go from there. But there's only like 5 doctors in the United States that can do the surgery. So I had to find a doctor that I was comfortable going to, meet with him, have him look at all my records and imaging and all of that, and approve that he would do the surgery. And then he's like one of the first doctors to do it as far as like in the United States. So it's pretty exciting. I'm very nervous. Of course, it's been put off since 2021 just because of cost of traveling, hotel, and then my insurance deductible. I've got to hit that. So, and then finding insurance to even do it. So it's just kind of like a process, but I do hope to have it done this year, fingers crossed. And then hopefully I will be able to successfully have another baby safely. So fingers crossed. I do meet with the high-risk doctors in January here, the end of the month, just to kind of talk to them about, even with that closure, would they recommend being on blood thinners or like Lovenox, or if I'm going to be able to completely not have to do those if I have the closure, or kind of how it's all working. So fingers crossed, good thoughts sent my way. But do keep in mind that, the main reason for this is I just wanted to put a most recent video out there to explain to people, what it feels like with the PFO closure. It is a very in and out procedure. Like, I think they started me at like 1:30. They finally came in. I think it was like more the prepping took the time. But they came in, got me like 1:30. Within like, I don't know, 10 minutes I was out. They asked me what I did for work, and that's all I remember, and I was out. And then I remember waking up and going through the discharge stuff and being sent home. And then I was sore for about 4 days. So I didn't really eat anything. I tried to eat soup and like stuff like that I didn't really have to too much chew or like painfully going down. But everything hurt. I mean, even the soup, just swallowing, it hurt. So I'm assuming those muscles, I don't know if I fought with them while they were trying to go down or up. I don't know. They didn't say. But like I said, I did go get checked out just for safe measures, and everything came back clear. So, yeah. If anybody has any questions, you can ask in the comments. Thanks.